All right, I love answering questions. Who's got one for me? Okay, lots of questions. Okay, I'll come back. Go ahead.
My name is Sandy, and my question to you, Dr. Oz, is you said that adults grind their teeth. I have 2 children that grind their teeth. You said it was stress. How is a 6-year-old stress?
You know, it's not only stress.
Okay.
You know, a lot of it has to do with how much you're able to move when you sleep. Some kids move around a lot when they're sleeping. And when you have your dreams and you're coming in and out of your dreams, you're not really paralyzed. It's when you're dreaming, you're paralyzed. So kids will have genetic issues that will often cause them to grind their teeth.
And
so
it's not every night. You know, it's certain times, you know.
But I think, let me go back 1 second. When they're stressed out, they may sense it because, you know, you're stressed out. Do you think that they grind more then, or you can't even correlate it to that?
No, I think when they're overtired, they stress, you know, they definitely grind their teeth more. One is getting braces on, and the orthodontist said that her teeth are fine, you know, but I do notice she does, and she wakes up with headaches.
She does.
So when you had mentioned the headaches, I had taken her for all this testing, thinking she fell playing sports, something, and I think it's because of the grinding of the teeth.
Kids have a lot more stress than we appreciate. And we went through our lives in a much different environment. And I do think that we underestimate that. There are lots of ailments like irritable bowel syndrome, depression. We never thought kids had those problems. Turns out they have them, we just never diagnosed it. So I wouldn't write off the fact that stress is a role. But it's not just stress that causes you to do that. It's also your body's ability to keep moving when you're asleep. Okay. And you know what? They won't grind their teeth down over 2 or 3 years. Let me see your teeth. No, you're not a grinder.
I'm not a grinder,
looks
no.
Good. Okay, thank you very much. All right, how are you? Yes, you get a hug. Was that your question? That's one question.
Hi, Dr. Oz. My name is Yana, and I wanted to ask, why does urine stink?
Why does urine stink? You know, I love questions like this because first of all, we're all thinking them, so you're brave to ask it. What does your smell like? Like urine?
Mine is just, I don't, Karada. What is it?
Here, hop up here. Okay. Are you her friend?
Yeah. Best friend.
Best friend. So what does her urine smell like? It brings tears to your eyes?
This is just funny. It smells, you know how, like, when you pee and it's there for, like, a whole bunch of days and it has that strong odor smell? Yes. Yeah, like that.
Is that true? All right.
Well,
go on.
I don't eat healthy, so maybe that's why.
And do you feel any burning when you urinate?
No.
So no pain whatsoever?
No.
All right, so basic rule of thumb, you should be drinking enough water so that your urine barely smells. If it's truly diluted enough, there won't be that many molecules in there that cause odor. So that's one rule of thumb. You're not drinking enough because it's concentrated. That's why it has the odor. I do worry about infections, but I worry even more about the kinds of foods you eat. When we eat foods that our body can't process effectively, a lot of those chemicals get secreted into the urine, and they'll give it a stagnant smell. But the bigger issue is no one's urine, unless you're having specific foods like you know, asparagus, which will give it a very clear asparagus-like odor. Most of the foods you eat should come out relatively odorless as long as you dilute your urine a lot. Okay. That way you'll go pee, you know, go to the bathroom enough, and it's not stagnantly sitting in your bladder for hours and hours. Okay. Thanks for being honest about it.
Thank you.
Guys, thank you very much. Thanks for all the questions, guys.